As a first aider, you may come across many situations that require your skills. You're about to learn a systematic way of checking a patient. This is called the initial assessment. We remember this by using the mnemonic Doctor's ABC. You'll learn to check for danger, assess response, shout for help, and then methodically check the patient's airway, breathing and circulation.
Ready to do it again, yeah?
No, actually, I'm just going to go and sit down. I'm feeling a bit faint. Is that okay?
Oh, really? Yeah, sure. What's up?
Nothing. I just feel a bit weird. Yeah.
Okay.
I'll get the instructor or something. I'll be back.
All right. I'll come find in a sec, okay?
Can we get some water?
Let us look at the steps of the initial assessment. After arriving at the scene of an accident, firstly check for danger. If it is safe to approach, next assess response.
Jess!
Shout at the patient to
Jess,
check
can you
for a
hear me?
response to voice.
Jess, I'm a trained first aider.
Tap the patient on the collarbone or rub your knuckles against their breastbone or sternum to check for a response to pain. If the patient still does not respond, they are unresponsive, shout for help.
Can I have some help, please? Can I have some help?
Airway. Open the patient's airway. If a patient is unresponsive, their tongue and jaw can relax and block the airway. Open the airway by using one hand to tilt the head backwards whilst lifting the chin with the other. Breathing. Next, you need to check for normal, regular breathing. Look for chest movement, listen for breath sounds, and feel for breath on your cheek. Check breathing for no more than 10 seconds. Send a bystander to call for an ambulance.
Okay, she's breathing, but she's unresponsive. Can you go get the ambulance, please? And can you come back, tell me how long they'll be? Thank you.
Can you call the ambulance, please? A girl upstairs has just passed out. She's unresponsive and breathing.
Yeah, of course, not a problem. Hi, can I have an ambulance, please?
Ambulance service, what's the address of the emergency?
We are Red Point Climbing Centre. It's 77 Cecil Street, Birmingham, B19 3ST.
3ST, just confirm that address for me there. Thank you, and if I can just take your phone number there, please.
It's 0121
Yep.
359 1777.
777, that's great. And tell me exactly what's happened.
Yep, we have a girl who seems to have fainted upstairs.
No problem at all, that's fine. So can I just confirm the lady, she's passed out, she's fainted there at the moment, has she?
She's unresponsive but breathing.
She is breathing, thank you. How old is the girl? 18, thank you very much. So you say not away, but she is breathing. Is the breathing completely normal there? Breathing is normal, and she's still unconscious there now?
Yes, I think so.
That's absolutely fine. Well, we've organised the help straight away there for you. What we would just advise, if you can have the girl, so she's lying flat on her back on the ground, with the head tilted there back, please. Did you say that you had first aiders on site with you today?
She has a friend with her, and we have first aiders on site who are on their way to help.
That's brilliant. They're happy to take control until the ambulance arrives there with you?
Yes, they are.
That's brilliant. That's all been arranged there for you. If you have anything else changes before we arrive, call us back immediately.
Check for circulation. If a patient is breathing, then they have a pulse, so there's no need to check for this. Instead, check for problems with the circulation, that is bleeding and shock. Check for and control any serious bleeding. Check for shock by feeling the patient's cheek with the back of your hand. If the patient is unresponsive and breathing, you can place them in the recovery position. In this position, their tongue falls forward and vomit tends to flow out, so keeping the airway clear. Kneel by the side of the patient. Gently lift the patient's head and place their nearest hand underneath it, palm up. Reach over and place the patient's opposite hand against their cheek. Then reach over and hold the opposite shoulder. With your other hand, reach over and lift the opposite knee. Pull on the thigh and shoulder together and roll the patient over as a unit towards you. Lift the patient's knee to right angles to stop them rolling onto their front. Adjust the patient's head and arm so that they are 3/4 of the way over. This ensures that the tongue falls forward and any vomit comes out. Finally, check for breathing. Stay with the patient and keep checking your ABC.